Thank you for joining us here on the NPTE Final Frontier Podcast. My name is David.
And my name is Emily. Today, we will be reviewing a question which involves treatment for low back pain. All right, warriors, let's dive right into that question. So, a patient presents to physical therapy due to low back pain caused by spinal stenosis. Which of the following treatment plans would be most beneficial for this patient? Is it option A, William Flexion Series? Option B, Mackenzie Extension Series. Option C, the Schroth exercises. Or option D, a low back manipulation. Okay, so now instead of diving right into the correct answer choice, let's first review each option to determine what would be the correct answer for this patient who again presents with low back pain caused by spinal stenosis. So first, option A, we have William Flexion Series. Now, this is a progression series, and what I mean by that is each exercise we would advance to progress the series for this patient. So we would first start with a posterior pelvic tilt exercise, and then progress to a single knee to chest, then progress to a double knee to chest, then progress to a partial sit-up, followed by a hamstring stretch, specifically in long sitting, and then a hip flexor stretch in that lunge bow position. And then our final progression would be a squat with our lumbar in slight flexion. Now, again, this is a progression series specifically for treatment of spinal stenosis. So, yes, option A does seem like a great option choice right off the bat, but we still want to review all of our other option choices before we can rule out any of our other options. Never forget that, warriors. So now we have option B, which is our Mackenzie Extension series. This is also a progressive series, specifically designed to treat conditions such as a herniated disc. Now, our first portion would be a prone position with pillow under the hips. Our next progression would be that prone position with no pillows, and then progress to prone on elbows, followed by a prone press up. And then we would have our patient standing, incorporating some extension there as well. So at this point, we can kind of cross off option B since this is more for herniated discs. And again, this patient population is more back pain from spinal stenosis.
Now let's review the other options. Option C, the Schroth method. This is a specialized physical therapy approach designed to treat scoliosis, a condition characterized by an abnormal curvature of the spine. The method focuses on individualized exercises that promote proper spinal alignment and posture. Key principles of the Schroth method includes awareness of the posture, breathing techniques, and individualized exercises based on specific curvature of the patient. The Schroth method is often used in conjunction with other treatments such as bracing and is beneficial for patients of all ages. Now let's move on to option D. Option D is low back manipulation, and this technique, which involves applying controlled, sudden force to specific joints in the lumbar region to improve mobility, relieve pain, and restore normal function. There is specific criteria for when a low back manipulation is indicated, which is as follows. Now, with all of these symptoms and criteria, you want the patient to score above or equal to 4 out of 5 of them. So they are as follows. The duration of symptoms is less than 16 days. No symptoms distal to the knee. lumbar hypomobility, at least one hip with greater than 35 degrees of internal rotation, and the last one is Fear Avoidance Beliefs Questionnaire Work Subscale, which is also known as the FABQ-W, the score of less than 19.
All right, so in summary, yes, the correct answer choice for this question would be option A, our William Flexion series. Because our William Flexion series, remember, is a treatment technique utilized to address low back pain, specifically in patients with spinal stenosis. But remember, just because your first option choice looks like an appropriate answer, you always want to review all of your option choices to make sure there isn't a better option available. So always make sure you read through all of them, warriors. Great job.
Way to go. And now that you understand the various treatment techniques for low back pain, here is a quote from Brian Tracy. Fake it until you make it. Act as if you had all the confidence you require until it becomes your reality. Fake it till you make it. You may not really believe that you are going to pass or succeed or get your dreams, but if you keep on faking it, keep on going through the motions, keep on telling yourself it, you are going to start to believe it, buy into it, and then you know what? It's going to become your reality. So start speaking it, start thinking it, start doing it. You are powerful, you are strong, you are a final frontier warrior, you will pass.
Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok.
Till next time, have a great day and a powerful tomorrow. Thank you once again.